essentially, if people are not lonely, if people are more active mentally and physically, people will live longer. Right? How many of you here have read this book called Ikigai? Anybody has read it? The little blue book? There's one lady back there. Yes, Dr. Danya, of course, he practices it. So there's this book, right, which talks about blue zones in the world. A blue zone is an area where the majority of the population lives above the age of 100. And then this Japanese researcher went and stayed in all of these blue zones, some are in Okinawa, in Japan, in Puerto Rico, and a few other countries. And they identified 5 factors that contribute, which are common amongst all these people of different cultures and different lifestyles. Right? And they said these are the 5 things that are in common because of which most of them are living above 100. And those 5 things are, the researcher found that everybody is physically active, they have a sense of community, they have a sense of purpose, they eat 70% of their stomach's capacity, and that they interact with nature. Right? This was the findings of that research. So we at Primus, what we are essentially trying to solve for is, we're trying to see if we can bring the values of Ikigai within our physical space where we're making these homes and taking care of elders. Along with that, the other most crucial piece is healthcare and age.
People are collapsing at the age of 40s and 50s in gyms and houses. That's not the kind of healthcare setup you want, where you are able to only solve for when you have a problem, right? So the whole endeavor of Bridge Health is to create an alternative, functional medicine based, proactive health setup. Now what does it mean? It combines, excuse me, it's all the power of the clinical capabilities that we already have, but combining that with things like nutrition, things like yoga, things like functional medicine aspects of fitness, and bringing all of that into one single package. We call it healthcare as a service. Right? So how do you make sure, and especially for elders, one important takeaway which all of us know in our hearts is that we take care of our children so very closely, right? The elders also need to be taken care of in a very similar way, right? Because they are in a very important stage of their life. They've taken care of us and now we need to take care of them. Built with the focus of providing everything that's needed for elders in terms of leading a good, healthy life, right? So it contains, for example, taking care of emergency care for them in case they are under the weather, but at the same time looking at proactive health. So for example, how do I predict what are the possible problems they may have in the next 3 to 5 years? We've got a tool called health risk assessment to do.
That is the whole reason why I limped purposely. So you've seen that I'm not really fit. So anyway, let me just go on to that. I'm one of the first residents who actually had enrolled on it because I'm a proponent of such a project. Mainly because I worked as a general practitioner in UK for 45 years, and this is the model we choose from, like you said, Mr. Gopal Krishnan, from the very young to the very old. And the geriatric care is the most important bit for us, and how we prevent is more prophylactic than reactive. The curative is not the right word I would not use because they may all not be cured, but they may all be reacted, and we can actually go and see what we can do to react and help them out. So whether we can cure them is not an issue, but I would definitely say it is an important issue that we need to be prophylactic. We need to make sure that everything is assessed, and as a doctor and as a resident who is in my late whatever years, that's okay. Anyway, I'm age 0 if you want to know my age, that's fine. But anyway, going back to this issue, what I believe in is mainly that we are not only getting old and we want our peace of mind while we are living, but our children who live abroad want peace of mind as well. And that can only be provided by being under some sort of a scheme which will give you some protection to make sure that you are being monitored, you're supervised, the people who look after you are trained, and you want to make sure that you access that health when and where you need it. It's no point in accessing it when you have already fallen ill. I think it's important that we actually take care of our health ourselves, and that is actually provided as a proactive issue And the more important thing about the bridge health that I like is actually the holistic approach. I think nobody has mentioned it here.
Today we're very excited to collaborate with Bridge Health. At our very core philosophy, we believe in reducing the process of aging, and as part of that, it's our job to identify healthcare parameters before they go wrong. And we're very excited to be able to work on a proactive aging plan with Bridge Health, which ties in well into our Primus philosophy of providing a space of care, convenience and comfort. Thank you.
So today, Bridge Health and Primus announced a partnership for a One Care program. The philosophy behind One Care is to provide a managed health assessment and care on an ongoing basis throughout the year, such that we can keep the individual healthy longer, so that we can prevent them having to go to a hospital with a disease, reduce the incidence of diseases, so that they age gracefully, they age healthy, so healthy aging, and since it's managed care, the fees is also predictable. So I'm very happy that Primus, which is a senior living facility, and Bridge Health, which is a managed care facility, are coming together to announce this program, announce their partnership today. I'm an investor in Bridge Health. Bridge Health is one of the few investments I've made in the healthcare space. It's open-ended at this point because we're still trying out the model, and so it's difficult to, at this point, pinpoint how much will be required to be invested.